up and not turn my camera on because I think it might help. I don't know. So, but you can see my picture there, right?
And a beautiful picture at that.
Okay, so I think I'll just do that. That might help the bandwidth or whatever, I don't know. So I would like to welcome everyone. This is David Frey. I'm Vice President of Education for the American Academy of Developmental Medicine and Dentistry. And I'd like to introduce our president, Dr. Alan Wong from University of Pacific in San Francisco. And tonight we're going to be interviewing clinicians in China, in Guangzhou, China, with United Family Healthcare. And we're going to introduce them shortly. Dr. Wong, would you like to give us a welcome?
Hi, yes, good evening. Welcome everyone to our virtual grand round for the AADMD. We're very proud tonight to host a very exciting segment. The virtual grand rounds is hosted by our student and resident chapters of AADMD throughout our country and in other countries as well. And it's very inspiring to have our young leaders of the future create this environment for us. So we're very thankful for the student resident group for putting this all together. Again, as Dr. Frey had mentioned, being Vice President of Education, he has a wonderful program tonight set up to interview what is being done in China, specifically from the United Family Healthcare, the Guangzhou Hospital. And we have three fantastic, actually four fantastic speakers joining us tonight. And we welcome you here. And we have panelists from AADMD board members as well. Dr. Lynn Taslett from the University of Pittsburgh and Dr. Frey from University of Texas. Thank you for everyone attending tonight. I'm going to turn it back to Dr. Frey to introduce our wonderful panelists from China. Again, thank you for attending and welcome.
Thank you, Dr. Wong. Thank you for being here. Lynn and I are going to be doing an interview. We'll be asking questions, and I'm going to I'm hearing feedback. I don't know if it's my mic or someone else's. I'm going to be interviewing Dr. George Kang, Dr. Gaynor, Dr. Tad Pu, and Dr. Alan Mease. And my connection is really through Dr. Gaynor, and I'll let her share that, but I had the privilege of working there in Guangzhou with United Family Health for a few years. So Dr. Gaynor, oh, Dr. Pu, we can see you guys now. That's fantastic.
With my phone.
Yeah. So Dr. Gaynor, I'd like for you to introduce yourself and your staff and maybe tell about our connection if you want.
All right. We are actually on Tad's phone at the moment, so I hope, can you guys hear us okay? Yeah, sounds good. Okay. So we may be that this is the pleasures of international technological collaboration. Anyway, good morning, everyone. Good morning our time, good evening your time. It's a pleasure to be here. Thank you for asking us to participate. So I'll introduce my colleagues. So I'm Dr. Kate Gaynor. I'm the General Manager of United Family Healthcare here in Guangzhou. And I've been here since 2011, and I'm a US board certified family medicine physician. This is Dr. Tad Pu. Tad, do you want to quickly give your background?
Hi, my name is Tad Pu. I'm a child psychiatrist here. I'm working for the United Family since 2013, and I'm working in Guangzhou United since 2014. It's been here almost 7 years.
And you've had training in Texas.
Oh yeah, I worked as a special ed teacher for a few years because of my passion for autistic kids. So I worked there for ISD for 5 years. I think it's become my record there.
Hi everyone, my name is Dr. George Kang. I'm the United Family Healthcare National Dental Director. I'm actually from the United States as well. I was trained in the University of North Carolina School of Dentistry, and in addition to that, I served some years with the Navy and in the VA hospital system before then embarking upon the journey into the private sector.
So I think you wanted me to give just a brief intro to United Family. Yeah. So We are a hospital network in China that was founded by a woman named Roberta Lipson, who came here from New York City in the late 1970s, just as China was really opening. And Roberta started a medical equipment importing company called Chindex. And she later opened the first United Family Hospital in Beijing in 1997. So we've been here in China for a long time. So now we're in Beijing, Shanghai, Qingdao, Tianjin, and Guangzhou, and even a clinic in Hangzhou and Boao. So a much bigger footprint in China now. And here in Guangzhou, we've only been open for a little less than 2 years in our big new hospital. Prior to that, we just had a clinic. And yeah, oh, there we go. Thank you. I can see our photo of China. So we're down there in the south in Guangzhou. That's our home. And part of what we're trying to develop here is a center of pediatric excellence. And part of that involves working with children with intellectual and developmental disabilities. And I think we can really extend that up into the adult population as well. But I think we'll get into a lot more details as we go on. So I'll turn it back to you, David.
So thank you, Dr. Gaynor. This is a picture of the hospital there. How many floors is that?
So the tall part is 15 stories. We're about 65,000 square meters. We're licensed for 105 inpatient beds, much bigger than when you were working here with us in Guangzhou.
Right. And I've been affiliated with United Family, really, I guess, since 2012. I helped design the first dental clinic in Guangzhou, just a little bit, and helped order some of the stuff. There wasn't much design to it. But this hospital that they have now, I had a hand in designing the dental portion, so I was really grateful for that. This actually is the picture of the pediatric clinic. George, would you like to tell us a little bit about the facility there for dentistry?
Yes. So, once again, we're very fortunate that you had a part in designing it. So it's very, the entire environment is perfect for seeing children and adults with developmental disabilities. Here, what we're looking at is one of our rooms that is essentially an open bay. And this helps to facilitate behavior modification, tell, show, do, as well as creating an overall inviting experience for the patient or the child. In addition to that, we also have a private room, or I guess you might want to call it a more quiet room, which is probably double the size of most of our dental operatories. And it's wheelchair accessible. We can actually transfer patients from the wheelchair to the dental chair, or actually do dentistry in the wheelchair itself if needed. So this is all part of, I think, what your vision was, Dr. Frey, when you were designing all this, in addition to the multidisciplinary approach that leads to our hospital environment, not only with Tad's team, pediatrics, family medicine, with Kate, Dr. Gaynor, but also with our OR facilities. We have a beautiful OR facility that we have really specialized for the dental needs of our patients.
George, you might want to move your thumb off the camera a little bit there.
Thank you.
We all saw your thumbprint very well. But I would like to say, I think it's important for people that we have a lot of students that are AADMD members in medical and dental schools, and they might not understand the way that Chinese culture has been, because many times you will have a child in China and accompanying that child will be two parents and two sets of grandparents. And so having these large operatories actually facilitates that. You don't get all these claustrophobic crowded in things. So it really helps to have a lot of extra room for lots of reasons. You mentioned wheelchair, but it's also true that when children come to a dentist in China, they come in family groups sometimes.
Right. Well, you're absolutely right. Because of the one-child policy, an entire family, an extended family, revolves around this one child. So going to the dentist or the doctor, for that matter, is definitely a family affair. Everyone gets involved. Everyone's trying to give their input, their advice, comfort the child. So it becomes quite exciting. You're absolutely right.
Yeah, and you know, for us that were trained in the U.S., we didn't develop those skills that you have to manage a group of parents and grandparents that all have opinions. And what I've learned with children with disability in China is that by engaging the families, it actually works well. And they appreciate that. And so we, at United Family, when I was there, I shouldn't say we anymore, I guess, but when I was there, we would spend time with the families. We wouldn't get in a hurry with a child with disability. We wanted the child to learn the operatory in an incremental fashion. In fact, we would give the families things to take home to practice, like a saliva ejector, or, you know, and talk to them about prevention. And so we spent a lot of time. Back then we had a pediatric dentist, Irene Lau, that was really, really good at being able to work with families. So I think what I've seen over the years with United Family is that they have dental clinics all over the country, and a lot of them have really fantastic faculty and good strengths. And I would encourage anybody that's listening to, you know, go online and pay attention to what's there. George, you might, I know your role is you're dental director there in Guangzhou, but you're also over all the dental clinics for the country, right?
Correct. That's absolutely right. And I would like to say that you always can say we, because once you're part of United Family, you're always part of United Family. So you can't lose us that easily. Yeah, I absolutely agree. And those are things that we try to train the dentists, especially the Chinese dentists that come from the public hospital sector. So the way that we try to treat our patients here is a little different than in the public hospital sector, where the dentist may have only 15 to 30 minutes to see a patient. And as you can imagine, that's not a lot of time, especially for a dentist. So what I try to do is I really try to train the doctors to first treat the parent and then treat the patient, or as you said, treat the entire family organization before treating the patient, because there's a lot that goes into taking care of a child with disabilities, or a healthy child for that matter, which we want to make sure that everyone participates in and everyone feels comfortable with before we then start the treatments.
Okay, fantastic. Well, I know that we've got...
Can I say something, Dave?
Yeah.
Dr. Frey? No, thinking back to when you were with us and when you helped design the clinic, you did a lot of training for our staff. You worked with Dr. Lee, who's still our pediatric dentist. And I will say that most of the staff of the dental clinic are still extremely proficient with their balloon animals. So David and I have worked together since 2004. And, you know, I've learned quite a lot from you about working with people who have behavioral issues, and, you know, about taking your time, about using, you know, unusual techniques, that, you know, letting them choose where they want to receive their treatment and how, letting them participate, even, you know, small children, in making some decisions. One of my favorite moments, well, this happened frequently actually, that Dr. Frey would bring me some patient that he had just treated, and he'd walk into my office with a small child, sometimes with bloody gauze sticking out of their mouth. And he would throw a sheaf of papers down on my desk that were their dental records. And he would say, look at this, uncooperative patient, uncooperative patient, uncooperative patient. This is the patient. Hello, little, you know, whoever your name is. Say hello to Dr. Gaynor. And the patient would look up at Dr. Frey and say, I love you, Dr. Frey. And, you know, with bloody gauze sticking out of their mouth. And, you know, one of the things that Dr. Frey has taught me is, you know, to get creative, get down on the ground with patients, you know, make your balloon animals, take your time. I remember one patient that you treated who was in the dental chair, laying on her belly with her feet kicked up in the air, you know, her head propped up on her hands while you did her work. And, you know, this was a patient who everybody said you couldn't work with. And she was just, you know, giving you hugs and I love you, you know. So I've learned quite a bit, and we try to propagate these techniques. And as you know, dental is very close to my heart. But, you know, so we are moving these things forward and incorporating them into our United Family way.
So the clinic was designed to support children. And I might bring Dr. Pu in here a little bit, because he and I talked a lot when I was there about how children with autism, you have to communicate with them non-verbally, and they have to feel loved. And, you know, children will remember how you make them feel. They may forget totally what you're trying to tell them. but I think United Family Healthcare is positioned to be a leader in interdisciplinary care. Dr. Pu, you're a child psychiatrist, but you're also kind of an expert on autism. And what do you see as what's changing in the field of developmental disability and autism in China, and how are families becoming connected maybe to United Family?
Well, that's a big question. In terms of in the whole scale of China, I mean, people are more aware of this, the needs of, especially for developmental disorders kids in China. And lately, we just got this national surveys on the incidence of autism. It's now 0.95% in China, which is closer to the world, the incident. Another thing is in the United Family, we the few of our, see Guangzhou now, for instance, is the leading part of taking care of developmental disorders. Now we have from beginning, Guangzhou pediatric department, we have screening for 18 months. We screen for developmental disorders. This is a standard already. It's the leading in our United Family. It's also, of course, leading in China, the whole in the whole medical field. Another thing is we have actually a ABA training center in our hospital. Another one, we have a speech therapist as a consultant working for us as well too. And we are also building in future more like occupational therapy. And also we're working with very closely with the Olivia Place, which is the leading rehabilitation center for China now. It's in the private sectors. As others, I cannot speak other United Family sites, but at Shanghai, we are actually working on a team for developmental disorders. I'm actually director for the Developmental Disorder Center in Shanghai.
You said something really important there about teams, which Alan and I were talking about last night. Trying to say, so Alan Mease and I had a conversation last evening to sort of talk about what we were going to cover today. And one of the points that came out most strongly was talking about interdisciplinary care as being so important in teams, which Tad just highlighted. And I think that that's something that's just so key, having integrated care across disciplines, which is not something that happens usually in the typical Chinese hospital setting.
That's exactly right. For instance, here in Guangzhou, all those pediatricians were being highly trained here in hospital. Also, they from outside facilities, we're training into taking care of developmental disorder needs, and also for dental facility. I mean, I also work in Shanghai. Compared to all dental department facility, nowhere to compare. And they were, sorry, Dr. Frey, I wish you could be there to design all dentistry. And everything we didn't design the way we facilitate the needs for developmental disorders. But Guangzhou United is taking the lead to give us a good.
I get questions a lot about China as far as disability, and a lot of times the answer is all families globally have the same issues. They have issues with getting health care for children with disability because maybe clinicians are not well trained or they're uncomfortable. At the same time, families, I think with COVID right now, they have to keep everybody at home, and I think it puts pressure. That's true in China, just like it's true in other countries. And I think that's the one take home that I always got when I work with families with disability, and both in Guangzhou and also in Wuhan, is that they're all kind of the same. The families are very innovative usually in trying to understand their child, but they're also big time advocates to try to help their child. What do you see the impact right now of COVID on families with children with disabilities, Dr. Pu?
Well, many of those training centers in China is not yet open because of the COVID. I know there's some school and some the kindergartens are already open, but those many cities, so we not allow those special needs program open unless it's a one-on-one setting. So this is very hard for the family with special needs for the autistic kids. It's very, very devastating.
Are you guys able to provide any counseling to family members?
Yes, I mean, for the COVID, I can speak for myself in our department here in Guangzhou and out in Shanghai. We do a lot of those telemedicine, conference for the family.
Yeah. So I think telehealth,
mainly working for the parents, you know, to how to desensitize, how to set up a working station and centers at home.
so telehealth has been really helpful, I think, for us here as well. I know that when I was there with United Family back in 2012, 13, 14, 15, we did a lot with, we didn't tell people what it was, but it was really applied behavioral analysis. This was ABA. We were able to give them goals to reach, and we worked with the pediatric department as well as the dental department, and we started prevention programs in the pediatric department. And we've got Dr. Mease, I think I've got you on the line. I think you've done things like that, similar things to where you guys did some prevention and wellness clinics with families. Is that correct?
Well, you know, the story of developmental pediatrics in China, as Tad knows, has been a long journey. Great. Can you hear me?
Yes.
And, you know, the issues, and I'm now in Arkansas in full disclosure, but I worked in China for 13 years, from one until 2014. And, you know, the issues are not all that dissimilar. The special needs kids and their families are challenged under the best of times. So people that are sensitive to their needs, like Dr. Frey and what you all are doing from the dental perspective, is really critical. And it's what I know is that although we made some progress in China, we have a long way to go in the U.S., as I'm sure most of you all know. Not everybody is sensitive to these issues, and special needs kids. The journey there was, we started in China in 2001, and the Chinese did not have the pediatricians there did not do well child care because it was a new concept. So why would you want to go to see a doctor to get your shots? You go to the public health department to get your shots, and what else is there to do but shots? You know, you don't need to monitor growth, development, and behavioral issues in kids. And so that was where we started, and we've made some good changes in training some of our Chinese colleagues that work in our environments now. But it was basically about, I don't know what year that was, it's hard to remember, mid-2000s that I began to recognize, and that's when I first met Tad. I said, a child psychiatrist, I got to get my hands on this guy, and we got to meld minds, because in America, to find a child psychiatrist is as rare as hen's teeth, as you probably all know. So to get to consult one is really good. So we work together closely to develop developmental screening, because I think one of the issues is to recognize early kids with developmental problems. And I'm in Arkansas now. I worked at the health department for about 5 years before I'm doing what I'm doing now. And you know, the average age of diagnosis for autism, I don't think Texas is any better, or most other states, but it's probably still 5 or 6, and that's ridiculous. That's, you know, unacceptable. You can diagnose autism 2 or 3 if you're paying attention. But the resourcing here is a challenge. So the challenges are a little different in China. I think awareness is where China is at, to recognize that there are kids that need special attention, and it's a journey, and UFH has done a great job. I will have to take credit for the fact that I was the one that convinced Tad Pu to come to Guangzhou on a regular basis, right, Tad?
Can I just add something?
Sure.
That's great. Can I add something?
Yeah.
It's Dr. Mease here. I mean, he's my old friend, and he's actually the first one when he started working for developmental disability disorders, and that's his passion. back in Beijing. He visited my center, which I had my center in Beijing that time. And he said, you got to work for us. You got to work for us. And before he left, he dragged me to United Family. And also, when he started working in Guangzhou, he's the one actually working for the early screening for developmental disorders. That's his job. That's where he started.
So Dr.
Alan,
Mease, go ahead, Dr.
Sorry.
Gaynor.
Yeah, so Alan, Dr. Mease was the person who started having us in Guangzhou use the written screening questionnaires for each well-child check. So using tools for autism screening, for the CDC questionnaires about general developmental milestones that we had translated into Chinese, so that we would have information available for the pediatrician before they began the visit to say, are there red flags here, things that we should be discussing?
So I think, Dr. Mease, as far as treating children with disabilities, with developmental disabilities, and working with their families, do you see families in the US and families in China as being similar in the way that you interact with them and the issues they face?
Similar, but different.
So what are some of the differences? Are they cultural?
Yeah, they're cultural. They're very, to understand the perspective and to not be judgmental about the Chinese perspective, which is equally valid to our perspective. And maybe
Right.
in some, my dream world is where we could learn from the Chinese perspective and they can learn from us. I don't think we're heading in that direction right now, but that's another story.
Yeah. Well, we've kind of set the table here about interdisciplinary care, and that was purposeful because that's what the American Academy of Developmental Medicine and Dentistry is all about, is being interdisciplinary in our approach with families and with people, both children and adults with intellectual disability. I've got two dentists from my AADMD board, Lynn and Alan, who run clinics. Lynn at University of Pittsburgh and Alan out at University of Pacific in San Francisco. Let me give them an opportunity to tell a little bit about their clinics. And really, I want to get into the nuts and bolts of how you might be interdisciplinary, how you deal with behavior. And I'll just start it with that. Lynn, you want to go first? You got to unmute your mic, Lynn. There you go.
Sorry about that. So our clinic is within the dental school, and we have a small 6-chair clinic, which we call the Center for Patients with Special Needs. And the people that primarily provide care are our 3rd and 4th year dental students supervised by faculty. We do have residents that come through on rotation. Some pediatric residents, oral surgery residents help us with the wisdom teeth and things like that. So it's a good experience for the students. We also benefit from having a dental anesthesia program in our dental school. So our clinic is housed in the school. It's a small section off to the side of one of the main floors of the school. We happen to be fortunate that we're near an exit of our own, so our patients can come and go through their own entrance. They don't have to parade through the rest of the school to get to us. And that's very beneficial. As you guys know, if you establish a pattern and a routine for those with autistic spectrum disorder in particular, but many patients with IDD, they love those routines. They like to come in the same way. They like to go out the same way. They like to see the same settings when they arrive, and preferably the same patients, providers. So in any event, we have a relatively small clinic, like I said, 6 chairs. 3 of our chairs are, 3 of our treatment areas are adaptable, that the dental chairs on wheels can be moved 100% out of the room, so we can provide care in a wheelchair or even on a gurney if need be. Those chairs that are on wheels are all bariatric chairs. One of the things that I've discovered after working with those on the spectrum for a long time is that many of the meds make them eat a lot, and some of these male adult patients, I forgot to tell you, our clinic is an adult clinic. It can be incredibly large. You know, we see these 6'4" patients that are 380 pounds, and they can't fit in a typical dental chair. So when we bought the chairs that were bariatric, I specifically looked for ones that were on wheels so we could make these multi-purpose rooms. The cool part about these bariatric chairs is the foot part goes flat. So some of the multidisciplinary care that we provide is not often, but we can have gynecologists come. And if a patient is receiving sedation and doesn't cooperate for even their gynae visit while without sedation, we can interrupt the dentistry or let the gynecological exam precede the dentistry. I kick all the dental students out of the operatory. We put up a protective screen. We allow the gynecologist to perform a pap smear and an exam and a breast exam if needed. And then we get them all dressed again, and the dental students move in and do the dentistry. So that's kind of new for us. And we've had probably maybe 14 types of coordination of care in that department. So, you know, we provide a lot of anesthesia, but we also provide a lot of behavior management and a combination of those things. We can actually provide GA with intubation in our clinic rather than having to go to a hospital setting. So that's super cool. We can prevent the trip to the OR for dentistry. But we can also provide everything from, you know, nitrous to oral pre-med to no sedation whatsoever. And it's not cookie cutter. Every single situation depends on what that particular patient needs in terms of their care. It's a great experience for the students. They can't skip us. They have required rotations all throughout third and fourth year, the equivalent of about 6-week-long rotations throughout those 2 years of dental school. So that's a lot to talk about. We use protective stabilization a little bit. My experience with adults is when we use protective stabilization in the form of a papoose, unless they've been introduced to that technique as a little person, they're very unlikely to just climb in there for the first time as a 35-year-old and accept that. They also get big and strong, and they can get themselves out of it if need be. One of my favorite things to do when we have cancellations is to get the students to wrap me up, because I can get out if they don't wrap me up correctly. You know, so, you know, it's a teachable moment. We also see patients with acquired disabilities, not just developmental. So patients with Alzheimer's, dementia, multiple sclerosis, ALS, spinal cord injuries, those are the smaller percentage of our patients. We primarily treat patients with developmental disabilities, just like all of you folks, but everybody from the age of 15 up. Our pediatric residency program manages the children with special needs. And they also have the ability to provide GA sedation within the dental school. So lots of things, you know, it's student driven, it's housed within the dental school. We have our dental anesthesia program, which was the first in the country, in our country. And, you know, that program has grown because we've grown, they've had to grow. So that was super cool too. It doubled in size even in the past 10 years since our center opened. So they're spreading out all over the country, our dental anesthesia providers, and hopefully the students that are graduating that are now alum are also providing care for those with developmental disabilities in their private offices. That's the goal, you know, not all the crazy sedation that we do, but the non-sedated cases that can be managed in private practices. That's one of my big goals, is to have this, you know, the typical patient that requires behavior management, whatever you want to call it, ABA, to be able to be managed in private practices and not have to wait on a big long wait list like the one for our clinic. So,
Well,
Dave, I'm not sure if that covered everything.
Yeah, that's great. I want to give Dr. Wong a chance. He's a hospital dentist, but at UOP, you guys also kind of pioneered the virtual dental home, which is a telehealth project. So I think that as dentists, we focus a lot of times on what does it take to be successful in completing a maybe a procedure, when really I think the thing that's frustrating for a lot of people with disabilities is they want to learn how to be a good patient. And sometimes how we deliver the service doesn't fit maybe their long-term need. And I know that at UOP, you guys have been able to do some things that are a little creative. Dr. Wong, you want to talk about that and a little bit about hospital dentistry?
I would love to. Thank you very much. Yes, we have a special needs clinic in our doctoral program as well, and we involve our dental students in caring for them. We find that exposure is the key to everything early in life. When you touch the heart, you change the mind. And that really sort of branches out quite a bit, because our practitioners want to help. They just don't know how and don't feel comfortable. But the more exposures they have early in the career, the more likely they're going to take care of them, just like Dr. Taslet's clinic as well. So we want to give them that experience, a positive experience. We want the patient to have a super positive experience as well. So they get that. They also get a rotation in hospital dentistry to see how complex dentistry is done in a caring manner and a multidisciplinary approach as well. So we also do a multidisciplinary approach with different departments from ENT to OBGYN, podiatry, otolaryngology, eyes as well. So we try to be comprehensive, and we try not to utilize general anesthesia unless absolutely necessary. So we involve ourselves in what's called caries risk assessment, identifying those that are at risk, and a lot of them are medications that dry their mouth that increases the risk of caries, dental caries. And we know that we can arrest caries with silver diamine fluoride. We know that we can treat dental caries without having to anesthetize if we catch it early. So early prevention is key to success and needless extractions. The virtual dental home that Dr. Frey was mentioning is our outreach program to those who can't come into the clinic or have great fear and can't reach us. So we have people go to them, either trained dental assistants or trained dental hygienists or even dentists, to go out to the community, gather data, and transfer it back to us in a secure encrypted format where the dentist can help diagnose and make recommendations. So that's one part of virtual dentistry. The other part of virtual dentistry is just communicating with the patient via a non-threatening vehicle, just like we are talking from a screen. And as Dr. Frey was mentioning, they want to be good patients. They just want to be familiar with you. So the more times they see you in a non-threatening manner, the easier it is to develop that relationship. And lastly, the part about the hospital dentistry, patients are living a lot longer and are getting more complex. And a lot of them are having osteoporosis, they're having needs for elaborate heart procedures as well. And when they're medically compromised, the safest area we can see them is in the hospital, unfortunately. And so we take care of them there. So we train postdoctoral dentists into taking care of people with advanced needs and handling them in that fashion. So thank you for letting me share with you what we do at University of Pacific. And I congratulate you all in China for what you're doing. And it sounds like you're growing the program quite well.
So I would like to get back to Dr. Gaynor and ask a question about maybe the future, because as I'm listening to Dr. Wong talk, I know that he does accreditation survey visits for a lot of our clinics. And I know that United Family is Joint Commission accredited. And not only that, you guys have done fellowships with medical schools in other countries. And so we've talked a little bit in the past about how we could be more collaborative, both interdisciplinary within what we're doing in our own worlds, but also how we can be more global in our approach and using technology. And I think that kind of shifts over into COVID. I think COVID is challenging all of us as clinicians to try to, rethink how do we provide care. In the past, as dentists, we thought of ourselves as a mechanic almost, we got to fix something. And now we're realizing that we're treating diseases, and maybe health promotion and prevention and this incremental model of care really might give us better long-term outcomes. So Dr. Gaynor, I'm throwing this back at you a little bit about how do you envision United Family becoming a leader in collaborative interdisciplinary healthcare for individuals with disabilities and their families? I know it's a big question, but I just want to know what you think.
It's a very big question. I mean, we're not the leader yet, but we're working on it. I think that's definitely one of our goals for the future. China has always been near the forefront of internet technology for healthcare. It's been fascinating to see what's being done with AI, with phone apps, with even cloud data. Much of the ability in the world for DNA sequencing was in China. VGI in Shenzhen, and it's so lots of fascinating stuff going on in the technologic world. And COVID has really propelled that forward even more. And many Chinese hospitals have online consulting and have had for years. United Family did not. And we were talking about developing our own online consulting. And COVID really pushed that. Like we rushed it to get it ready so that back in February we could turn on our online consulting services and start doing more online. But China has fascinating stuff going on with apps that mental health apps that can help detect if you're becoming depressed. They do face analysis and voice screening apps that help with diabetes management, and just to say this stuff is awesome. I mean, I know this is going on around the world, but China has been really out there. So we are pushing our online consulting for sure, and we have a major mission and desire to be highly involved in training. So we have fellowship training within our network for specifically family medicine and emergency medicine so far. So for the last, I'd say at least 7 years, we've been accepting training fellows so that we could develop people in the specialties of emergency and family medicine in the US tradition, the US style of care, because family medicine is not really a specialty in China. It has not been until very recently. So family medicine is starting to develop training programs. We have a partnership with a training hospital here in Guangzhou. One of our faculty members has become a professor at the 3rd affiliated hospital of Guangzhou Medical College. So even when I came to China, I'm a family medicine doctor. I was fascinated by the opportunity to be involved in watching China shift towards this idea of having a medical home, towards having somebody who knows all of your issues, who collaborates between different specialties and really makes your care interdisciplinary. This is happening. So these training relationships are happening. We're being looked to as certainly a leader in family medicine and integrating across specialty care. And then emergency as well. And in Chinese hospitals, if you're an emergency doctor, you do the surgical side or you do the medical side. If somebody comes in with a broken bone, having a diabetic crisis, I mean, oh my God, like which way do you go? So we train emergency physicians in the US style who care for everything. So I also envision us hopefully someday having a dental training fellow program, which I'm looking at, I know George would love to see also. We've had a great relationship since you, Dr. Frey, moved back to the US with the University of Texas. We were fortunate to have you visit, Dr. Badger, Dr. Sudarat, Dr. Gonzalez, to help us with our training. And we want to move forward with trying to make that a little bit more of a formal training program as well. We have various collaborations for online consulting and just exchange of information with many institutions in the US that have included Stanford, Mayo Clinic, Brown. So this is just, we're actively working to develop these relationships and to develop our training capacity. So that was a very long answer. I'll just highlight one more point, which is just since this hospital opened about 1.5 years ago, we're fortunate to have an entire floor of the hospital that's dedicated to meeting and training space. So we have one large conference room where we've hosted many multidisciplinary conferences, including a pediatric conference, which featured Dr. Mease, who we brought from the US last year for that conference, for pediatric practitioners from all over the province. And we've hosted ultrasound seminars, surgical seminars, OB seminars. We have lots of breakout space for training. We use it for our fellows. So training is very much a part of our mission and our future vision for United Family.
Well, that was excellent. I would like to say a little bit about the hospital has a fantastic therapy area. And you might even say a little bit more about that. But one of the questions that came in online is how do we integrate all disciplines, which includes occupational therapists, physical therapists, speech therapists. I think that one of the unique things about having a hospital situation where you've got everybody surrounding the individual with disability, you come up with an interdisciplinary plan of care. And I think that that's very good. As a dentist, I always like when I have patients with contractures and they're having a hard time brushing their teeth and they might have some behavioral resistance. And I've got an occupational therapist that's going to not just work with them on how they're going to hold a toothbrush and how they're going to brush their teeth, but can also reinforce some of the stuff coming from the behavioralist, from the psychologist, or from the psychiatrist. So I think that interdisciplinary care really lends itself in a setting like United Family. So because of the question, Dr. Gaynor, would you or Dr. Pu or Dr. Kang like to talk about your therapy area and how you incorporate that in an interdisciplinary manner? And then after that, we want to kind of shift over to talking a little bit more about COVID, because I think you guys have been successful. Although we're seeing here in the US, hot spots moving around the country and second waves. So I want to get the COVID question in, but before we do that, can you guys address therapy just a little bit more?
I'll allow Dr. Kang and Dr. Pu to comment, but I think that we should also give Dr. Mease a minute, because that was something else we talked about last night, that, you know, as China is progressing and providing better care in areas of intellectual and developmental disabilities, it's moved through the stage of being able to do screening and evaluation to starting to have more treatment options, but those interdisciplinary treatment options are still very much in development. Dr. Mease worked with one of the first multidisciplinary centers, Olivia's Place, with which we have a collaboration here in Guangzhou. This is also relevant to COVID-19. Is that the speech therapist that we work with is right now trapped out of the country. She's in the US and she can't come back into China at the moment. So, you know, COVID is giving us all sorts of interesting challenges. So one of the things that I love about this facility is that we can run around and kind of just if I have a question about a patient, like you said, that cuts across disciplines, I will run downstairs and say, hey, George, or I will, you know, we'll get on WeChat and say, hey, Tad, or I'll just, you know, we can actively collaborate in real time with our pediatricians, our mental health professionals, our dentists, et cetera, our OBGYNs, our whatever. We can call Olivia's Place. This can all happen in real time, which I love. Guys, you want to jump in?
Yeah, no, I totally agree with that. And when it comes to creating protocols and workflows that between different entities may take weeks or months, quite literally, it could just be an afternoon meeting of colleagues just getting together. So I appreciate all the knowledge and the specialization that lies within the hospital. And it's just been a tremendous experience to be able to, you know, work with these people for the betterment of our patients.
Yeah, this is Alan. The issue of therapists is a challenging one, because in China there are no therapists. At least there's no training programs for OT, PT, and speech. The Chinese healthcare system is basically gives the nurse training and even the physicians training as the therapist, because they don't recognize. They're only beginning to recognize. And Tad, you can follow up, because it's been a number of years since I really kept close tabs on this, but the therapists are an extremely important part. You know, OT, PT, speech, ABA are all necessary interventions potentially for the child with special needs, whether he's intellectually, you know, disabled, or whether he's got autism or any other number of things. So I think there's a ways to go there with regard to therapists, and working it with LIH or Olivia's Place, we were really looking to train Chinese therapists. And that initiative, I know, is still going on. I haven't had much direct contact with them for a while, but I know that's still going on. I think the other big challenge in China, you ask about differences. Mental health is a particular cultural challenge in China. Mental health, we have our own challenges with stigma here, but it's nothing orders of magnitude compared to the issues of mental health in China, where, you know, they have a lot of other approaches to things. So their goals and their values are different. Not that they're worse or better, they're different, and we have to understand them. So Tad, I don't know what you've learned since you know, with the therapy side of things, because I know Tad started a multidisciplinary autism clinic when it wasn't cool to do that, back in Beijing in mid 2000s, right, Tad?
Yeah.
Thanks, Dr. Mease. I've been back to China for about 12 years already. And when I started from Beijing, there was no BCBA, literally none in China. But now we have so many in the big cities. And also I know in Beijing, we have BCBA training center for the Chinese BCBA whoever wanted to learn that. And also in terms of this speech and also occupational therapy, we didn't have that in China. I mean, we still don't have that in China in university. We don't have that as a disciplinary training in the fields. But now I know Shanghai Normal University, they started a program already. And also I'm glad to see many of those bilingual, those Chinese students being trained in the Western countries like UK, US, and Australia. Now they return to China and provide bilingual services for our kids. This is a big new shift, a new change now. I'm glad to see a lot of students coming on board in this field.
I think it's worth mentioning just briefly, we keep talking about this Olivia's Place. What is that and where did it come from? And it was founded, I don't know, maybe 10 years ago, Alan, no, by maybe even a little more, by
12 years ago.
Yeah, 12 years ago, by a guy named Nelson Chow, who had been working in Silicon Valley in the US and wanted to relocate to Shanghai to be near family. And he and his wife have a daughter who had needs for multiple therapists. She needed speech therapy, occupational therapy, PT, etc. And he thought, well, Shanghai's a big modern international city. We'll move back and I'm sure, we'll find what she needs. And he had a big challenge trying to find his daughter, Olivia, the services that she needed. And he decided he would just start them himself. So he created Olivia's Place for Olivia and for other children in Shanghai to receive this multidisciplinary care. Everything from educational testing to speech, occupational PT, etc. And then a second center grew up in Beijing, which was Elliot's Corner, which was named for Elliot, the child of another friend. And it provided services in Beijing. And they've since partnered with this LIH, which is a large Chinese company that's enabled them to grow and relocate to other cities as well. They have a presence in Shenzhen, which is about an hour away from us here in Guangzhou. And we've started partnering with them to help us expand into these different specialty areas of therapy and offer these to our patients.
By the way, just for our listeners, I'm in Houston and we're the 4th largest city in the United States and we've got somewhere around 5 million. I think the last I heard, Guangzhou had 17 million or something like that. And
that's probably about right.
Beijing is like 25 million. I think people in America sometimes don't realize the large populations that are in China. We did get a question about trauma-informed care. And while that is a topic we could talk for an hour, it's very true that globally there are health disparities for people with disabilities. And one of the saddest things is a lot of people with intellectual disability are bullied in school. They can be physically and sexually assaulted at higher rates than other populations. That's been true across all countries. And I know, Dr. Pu, you have to deal with families that deal with really difficult issues sometimes to kind of heal these emotional scars, and you can't really heal some of them. But people with disabilities that are nonverbal tend to use their behavior to express some of their frustration. And sometimes as a dentist, when somebody comes to my dental chair, if I don't really understand that person fully and I just am looking at their mouth, I might miss the key factors that are really important in trying to be holistic and treat the individual within the context of their family. And so I wanted to kind of talk about that just briefly because we had a question about it. But the other thing that kind of tied in is somebody asked about the virtual dental home. The virtual dental home is actually using telehealth to communicate with families and people about their mouths using intraoral cameras, but it also enables us to take portable dental equipment and go to somebody's natural environment, go to their home where they're comfortable. So the clinic doesn't have to be the place that they first build a relationship with people that are in turn going to help them develop to be a little bit more amenable to treatment. I like to say that I'm against the FAAP boost board, and I have to qualify that because I can't say I'm always against it. I think if you had an injury and you fell down and they rushed you to the hospital and you were incoherent and they had to take an x-ray and stop the bleeding, they would probably in some way immobilize me. So I think there are emergency situations, but I think for most of the time with dentistry, if we look at people and step back from the situation and say, well, what do I have to really do today? Because what I really need to do today is maybe use silverdiamine fluoride, which Dr. Wong mentioned, or try to help the family understand prevention. Now, if there's pain involved, we want to try to resolve that. But what we can do is we can transform people into good dental patients, sometimes quickly, just by communicating with them with love and understanding what their behavior is telling us, as opposed to try to get them to conform to our environment. So I would look forward in the future for us with AADMD to be more involved with United Family. Certainly if we could do fellowships or we could do any type of online training, I think the more we talk, the better and more interdisciplinary we come. But we did have those two questions that came up. The last thing I wanted to close with is, how are you guys dealing with COVID, and how has that impacted your hospital and your families? And in particular, how does it impact people with disability?
I'll take the trauma
Which
business.
one? Start first? Do you want?
Whatever.
Okay, well, just the overall hospital response, one of the first things that we had to do was to control and screen arriving patients. So we started hearing about this situation, of course, back in December in Wuhan. In January, I came back from being on a holiday for Christmas and New Year on January 5th. On January 9th, we were having a training exercise, and we decided to make coronavirus the subject of that exercise. What if somebody showed up and said, "Hi, I'm from Wuhan and I have a fever"? How were we going to handle that? And we practiced, how we would escort them to the fever clinic, what PPE needs to be worn, etc. We started controlling our entry points. We put up signs on the door saying, "Stop, let us know if you have a fever. Have you been to Wuhan?" We put out hand sanitizer and masks, etc. And then as things ramped up, I think it was January 23rd when Wuhan was actually shut down and locked down, and we started to say, Chinese New Year is the first year, the Lunar New Year was the first week of February. And it's a huge mass exodus around, people travel all over the place. And that holiday was actually extended for a second week. People were told to stay put, don't move. It became quite evident that this was a very serious situation. So we shut down to one entry point in the hospital. So everybody had to come and go through one entry point. We were doing temperature screening on everyone. Everybody had to answer questions about where they had been. Everybody had to wear a mask. And we really only just started to ease up on that. We now have 3 hospital entry points, but still all with temperature screening, questionnaires, etc. That's in general how the hospital has responded. We had to decrease our number of visitors. We only allow 1 visitor per patient. Visitors have to be screened for COVID-19. We actually are a testing site for COVID-19, although not a treatment site. There are a limited number of treatment sites in Guangzhou. If someone actually tests positive, they must go to one of 9 designated government treatment centers. But at the moment, there are no COVID patients. Knock wood. We are not seeing any community transmission right now in this province. Guys, thoughts about COVID?
Well, during the COVID time is when I actually moved from Beijing to Guangzhou. So that was interesting in and of itself as well, because they have the Chinese have tracing apps, so they can actually track where you've been. And so for a while, we weren't allowed in certain buildings because we hadn't been in Guangzhou for the 14 days. I actually have 3 boys, 19, 16, and 11. And so they were continuing their school online in Beijing. And then when Beijing opened their schools, we were still able to go online, but then as we all know, they had another episode in Beijing, so they shifted back to online classes for everyone. So the question for us now is, my eldest son is going to university in Beijing in September, so we're not sure whether or not it's going to be online or in person. So it's affected my family quite a bit, but we're glad to be here, and I'm sure China right now is a little safer than most countries.
I can also speak for since the early February, I was in Shanghai. I went back to work already, but we're not allowed to see anyone from the outside of Shanghai. And anyone from outside Shanghai, number one, we need to check temperature, and also we have to see them in the negative pressure room with all PPE guarded. That was uncomfortable.
Yeah.
and then I couldn't come to Guangzhou for about 3 months, and I started in April. Started coming back to see my patient because And during that time, I'm doing lots of online sessions with my clients in Guangzhou. And as well, I did a lot of the online sessions with people all over the world, I can say. They stuck in the US and overseas, and of course in different parts of China. And especially for my clients in Guangzhou, tele services, I've done a lot of those. And as well as we are, as a mental department, we do a lot of kind of online sessions and all that, just to see how we cope as a family, especially with the kids with special needs, and how do we cope with them, and especially they're all stuck at home and cannot go out. Everyone not downstairs, just home for a few months. So that one we done a lot of those kind of little video clips and all those kind of session trainings for those parents.
I see we're running out of time, but I will mention very briefly that we had a very real situation here last week that we're still workshopping to try and improve. Or we had a patient, a young boy with autism, show up for his appointment, and turned out he had a fever when he was screened at the front door. So rather than being able to go straight to see his pediatrician for his checkup, he wound up having to go to the fever clinic for screening first. It's a very long, drawn out process, going to the fever clinic, seeing somebody who's dressed up in PPE, getting a screening test. So, you know, this kid wound up kind of having a meltdown, and just we're trying to figure out how to handle that situation much better in the future.
We're here. We can
Alan,
still
are you
hear you.
gonna talk about the trauma?
Well, trauma is stress, and you know, it's one of my passions. Can you hear me? I'll shut down.
Yes.
You know, and we have to be careful in the healthcare business of not contributing to somebody's trauma. And dentist is a good example of potentially contributing to trauma, depending on how it is approached. You know, what we've learned in developmental neurobiology since the last 15 plus years is that we have to understand that there's good stress, bad stress, and toxic stress, which is what trauma is. And it's just exceeding the capability of the individual to adapt to the stress. And this is a big cultural change for us Americans, for goodness sake. I mean, we are, you know, if I could do it, if I had to do it, you guys can do it. And it has to do with our thinking about parenting. Harsh parenting is trauma. Harsh parenting is trauma. The use of physical discipline to parent is trauma. And Arkansas has a major problem. I mean, everybody believes spare the rod, spoil the child, and this is a big problem. It is also a problem in China, although it's a little different twist to the whole thing. We could talk a long time about that, so I know we don't have time. But trauma-informed approaches to things, we have to recognize if somebody has been traumatized in early life, they're going to be very sensitive to anything after that. And we know that affects brain function, and it's probably a cause of some of our special needs kids, particularly in the mental health business and probably in the developmental health business, that it's early life adversity that causes some of this stuff. And America has a big problem with this. China, the problem is there, but it's a different kind of approach. And we could have a whole conference on this.
I always worry about trauma when it comes to not knowing. I meet these patients when they're adults.
Right.
Maybe adults, maybe older adults, could be any age. And I don't necessarily know their background because possibly by the time they're coming to us, they're in a care facility, their parents are less involved, or their parents might have been the brucks of the trauma, who knows? And then, you know, and then I'm gonna do dentistry. And so a lot of folks, you know, we don't like to just automatically sedate everybody, but I also don't like to not know somebody's history and then try to put them in protective stabilization. And particularly if they also have a seizure disorder, and that's just adding to the complication. My experience is patients who are fatigued will mess with their seizure threshold, and they're more likely to have a seizure if they're fatigued. And how much more fatigued can you be than flailing around inside of a protective stabilization device? And then now you have a secondary problem. I have a kid who is traumatized and is also seizing. And now how am I ever going to get him to have dentistry?
Well,
Um,
the thing about trauma is the first 3 years when we're most sensitive to it, we don't have any memory of. So if your parents are still alive, you ought to have a serious talk with your mom and ask her, tell me what your life was like, you know, during your pregnancy with me in the first 3 years. So at least you know what happened, because you right now don't know. And so you're right. We're dealing with the patient who don't know.
George, you use protective stabilization at all in your clinic?
So yes, we do use protective stabilization. In fact, a lot of the Chinese parents here prefer that method over going to do any sort of sedation or the OR. I find that a lot of the Chinese parents not only prefer protective stabilization, but they also prefer for us to perform dentistry on their child without anesthetic. So it can be a little interesting, I think, when you interact with parents like that.
I'm also interested to know about the use of SDF. I mean, is that pretty common in the pediatric world over there and the special care world, more so than outside of special care?
Well, in Shanghai.
What's STF?
Oh, sorry.
SDF, silver diamine fluoride. I'm sorry.
Oh, SDF. Okay, sorry. Yeah. yeah. Sorry. Go on.
So that's not something that we particularly use here in China. It's not something that my providers use. So I really can't comment on that.
I don't know if we have access.
Yeah, I don't. The government regulations to bring materials in, especially medical materials and dental materials, is fairly strictly regulated. So there's certain things that I'm used to working with in the United States that I just don't have access to here.
Well, I can speak to that a little bit. Most of the research, early research on silver diamine fluoride was done there in Guangzhou at Sun Yat-sen University. And it was done in the 90s. A lot of it was published, and it was done with school children. So early on, it was developed there. There are actually 4 products. And at one time, there was a product from Japan that you could purchase in China. But the Advantage Arrest that we use here in the U.S. is not available in China. While we've been doing this, I don't know if you guys looked at some of the slides, but those were pictures that I took of the dental clinic there in Guangzhou, not in the hospital, but in the old clinic. And basically, these were ways that we tried to make it fun and made people relaxed. And we would have people come in and just hang out sometimes even when they didn't have an appointment. And we used toy balloon animals with children. For adults with disabilities, we didn't have that many patients with disabilities. We had some. But we were able to achieve the same kind of results by using an incremental model. And I do think that as dentists, we've got a lot to learn about trauma-informed care and how we can maybe do it in a different way. So that's something that we're researching right now. Peer-to-peer mentoring is really effective. This was actually done at the, George, you probably recognize these dental chairs over at the old clinic. But yeah, these were actually twin brothers. And so we worked on one, and then after we finished him, he actually got to do a lot of things with his brother. And that peer-to-peer mentoring is a behavioral technique that's very effective. It's also really important to get families to start doing a lot of things at home and do a lot of reinforcements. So I think this discussion of trauma-informed care was fantastic, and I appreciate everybody's where they're coming from. It's also true that if you've got somebody that's got massive decay, like I showed earlier with early childhood caries, you don't have time to incrementally change behavior. You've got to get in there and do something. And so there are times that we do have to fix it. But I do appreciate all of the approaches that have been utilized at United Family and the multidisciplinary attitudes. I've also appreciated a lot of our questions that were coming through under the chat. We did have one question from Alice. Alice, if you're there, if you want to ask your question, I think you can be unmuted or make a comment.
No, I apologize. I just hit the wrong button. But it's nice to see a UNC grad over there in China. I live in Raleigh and went to school of public health.
Yeah.
Oh,
Well, we also
nice.
had,
A fellow Tar Heel.
we had some really good comments. I think there was one comment about there's nothing more important than trust. It can't be coerced, has to be earned. I really, really believe that. And then somewhere here was a suggestion that we go to a website, but I'm not seeing that right now. So if
Dave, while you're looking for that, since we have so many students on the call, I presume, I was interested in the training for dental and medical school in China compared to the States, because I think that might be interesting conversation to a lot of our young attendees.
George, you want to speak to that, or?
Sure. Unless you would like to start first, Dr. Frey.
No, you go ahead.
Yeah. So we find that the dental training here in China is a lot different actually than in the United States. For instance, in the United States, we have a governing board and make sure that all the dental education is similar and set to a different standard. Here in China, depending on the region, you might have a dental school that's very good and a dental school that's actually not very good in terms of reputation and education. In addition to that, there's different levels here where you can have a bachelor's of dentistry, and then you can go on to like a 5th year, a 6th year, a 7th year to try to improve your skill set more and become go into a master's program, a PhD program, and things like that. But typically what I've especially seen is a lot of the schools primarily here are focused more on academics or the didactic portion. And then from there, they transition into the public sector, the public hospital sector, where they get the repetitions, where they get their patients experience and things like that. But then they get trained very quickly because, as I said, a lot of them, they'll see patients every 30 minutes. And for many of them, they're doing that without working with a dental nurse or dental assistant. So they become very skilled at doing crown preps or fillings or root canals and things like that. But then when they transition into the private sector, it's where, as Dr. Frey and we've been talking about just before recently, is where they need to learn their communication skills and their patient interaction skills, treating the patient more than just the tooth, but as an individual and trying to create that holistic care.
Yeah, I actually I went to medical school in China, and we have a dentistry department, and they gone through 5 years training just like us. So they all go through similar trainings, but then it's more like a medical. I know it's just any kind of like surgery and any department the same. But my personal experience with dental services in China, I was horrified. I mean, I can understand my clients now, and I get on my child now, my kids, when they get on say my son, it's ADHD and a little bit anxious. So when he get on even see a dentist in Shanghai United, and I give a half tablet, like 0.5 milligram lorazepam. So he's more relaxed.
Dr. Fu, you probably need to talk to Dr. Mease a little bit about your childhood trauma.
So one additional question about education, is it typical, so in the States, the average student goes to 4 or more years of undergraduate school before they apply to dental school? I understand that's quite a bit different over there. You know, they don't really have a traditional college, so to speak, right?
Correct. So they would go straight into their dental education program. And then once again, from there, they can go from the 4 years to the 5 years, 6 years, 7 years, and specialize.
But there's no bachelor's degree. You
There's-
graduate from high school and then you choose your
Yeah,
To go
you have
ahead.
students as young as 18 starting dental
Yes.
school.
Correct.
Yeah.
Correct.
Then you probably have 5 years residency also.
Did you say 5? 5 years?
Yeah,
of
it's 5. It would be
Usually
5
5.
instead of our 4. And then after that would be specialty training.
Correct.
So they have
Yes.
endodontist and periodontists and oral surgeons, and so when you add all the years up, it kind of comes out pretty similar, really. I just think that they have the ability at some they have different stopping points in their education, and they have the ability maybe to provide some care. So they don't have dental hygienists, but they have dentists with a bachelor's degree that function a lot of times as doing a lot of those same functions. So
Is there such a thing as a dental anesthesiologist in China?
yeah, there is. Yeah, they have them in the schools. I think at United Family they just have a regular anesthesiologist that can also go to the dental clinic. But yeah, they do have in the dental schools, they do have the ability to learn anesthesia. So I think you would find it similar to us, but different in certain ways. Dr. Wong, you might be familiar a little bit more. You've been to China and with Special Olympics, you might be able to comment on some of that as far as their specialty training for anesthesia. Do you know?
I do not know offhand. I'm sorry.
Dr. Kong? I don't know if I can fully answer that. Do you know, Dr. Kong?
No, I don't know. But I think an interesting thing to note is that many of our dental nurses, so we don't have dental assistants here, we have dental nurses, but there aren't very many, if any, dental nurse training programs. So many of our nurses are actually medical nurses, and we end up having to train them to do four-handed dentistry and things like that from scratch.
Yeah, their medical training actually helps, though. It's actually pretty beneficial.
Yeah.
I do think that a lot of times, understanding how things are going to get done, and it's a different system. It's kind of hard for us just to plop down and understand it. It took me a couple of years to try to kind of see how things worked. One of the challenges that I saw was there were a lot of dental labs in Shenzhen, but they were working with people in the U.S. They were doing a bunch of work for U.S. dentists. And it was, to me, that was a surprise. So there are things that are different between the two systems. I think we've kind of gone over our time a little bit, but I want to thank Dr. Mease and Dr. Wong and Dr. Gaynor and everyone else here and our attendees. I think this has been a robust discussion to kind of see that we're all in this together, trying to figure out ways to best serve people with intellectual and developmental disabilities. I think the biggest challenge is how do we get past pediatric care? How do we do that transition, and how do we support people when they grow up? The discussion on trauma-informed care, Dr. Mease, that was great. So I really want to thank all of you guys. Any final comments from anyone? Dr. Wong?
Well, I just wanted to thank everyone again, just like Dr. Frey and Dr. Frey, for helping set this up. This is a terrific discussion. It's kind of unifying that we have problems that are similar in different countries. I think the answer to the question is education and experience. And like I said, when we touch the heart, we change the mind. So we just have to gather the right type of clinicians who want to do this and help mentor them along the way. But terrific discussion. Thank you, everyone. Dr. Pu and Dr. Mease and Dr. Kang and Dr. Gaynor. Thank you for all you do in China. And thank you, Dr. Teslet and Dr. Frey for
Yeah.
what you're
So
doing.
my parting comment is listen to families. Trust your families. It's really the secret to success. I think as dentists, when I was in dental school, we were taught to keep the family and the parents out of the operatory. If you let them in there, the child's going to act out. And I found with children, any child, not just people with disabilities, that when you embrace the families and bring them in and make them a part of the team, they actually become better at being a good parent. And in addition to that, they help us look a lot better. We get better results. So I want to thank everyone. I wish you guys well, a happy rest of the day. And for everybody else here back on this side of the Pacific, have a great evening. And with that, I'm going to go ahead and close it. We've had some really good comments, by the way. Lots of thank yous. Take care, people.
Thank you
Thanks,
for
everybody.
AADMD.
Thank
Aloha.
you, everybody.
Everyone.
Bye-bye.
Bye. Thank God for your